Hello, my name is Scott Eshtay, and the middle range theory that I chose for this assignment is called a new theoretical model for the development of pressure ulcers and other dependence-related lesions. The sole purpose of this study was not to address the systemic origins of pressure ulcers, such as venous or arterial origins, but to propose a theory for the etiological factors of pressure ulcers. This theory addressed all four concepts of the nursing paradigm of person, environment, health, and nursing. John Watson, an American nurse and theorist, defined person as promoting the practice of satisfying human needs through human care, i.e., the patient. The person or patient is the primary focus of this theory. In finding the etiological origins of pressure ulcers and positing a theory for their avoidance, we are satisfying the person's needs. The focus of health coincides greatly with the focus of the patient for this theory. When the patient remains free of pressure ulcers, their overall health is actually promoted and improved. The environment is also addressed. In order to promote a turnaround in pressure ulcer occurrences, the environment of nursing needs to adapt and promote healthy work habits so that patients' pressure ulcers became a thing of the past. Creating an environment that promotes practices that reduce the occurrences of pressure ulcers also touches on the aspect of nursing within the meta paradigm. This theory fits incredibly well within my healthcare setting where I work, which is the ICU. The vast majority of patients within the ICU do not move much, whether due to physiological inability or because they are often sedated. Because of this, they are prone to receiving numerous pressure ulcers, and oftentimes they are if they're not turned enough. Or, the theory states that the correct diagnosis and management of risk dimensions is essential for the prevention of dependence-related lesions. If the lesions are properly classified, then they can ultimately be avoided. One type of lesion is a moisture lesion. These come from prolonged exposure to moisture, including urine, feces, or wound exudate. By simply keeping the skin dry from these sources, by applying moisture absorbent pads underneath the patient, and consistent monitoring, moisture lesions can be avoided. Secondly, pressure ulcers are a direct product of bony prominences of the body keeping constant forceful pressure upon another surface. By just frequently turning a patient side to side and cushioning the bony prominences and also keeping them dry, you can help to reduce the instances of pressure ulcers. Thank you.